Today we are going to talk about ambulating successfully with tethers, and tethers are anything that is attached to your patient that could potentially get in the way and cause a fall. I'm going to show you certain things that can be considered tethers. First we have SCDs, which prevent clotting in the legs. We also have Foley's, which are shown here, and they're connected to the bed frame. We also have an IV, which can be connected to the IV pump. Can be a blood pressure cuff, which would be attached to a machine, and there's also oxygen, which can be attached to the oxygen machine. There are certain rules while transferring a patient. You need to make sure that they have on protective gear like non-skid socks or a gait belt while transferring to prevent falls. Also, you need to always communicate with your nurse and make sure the number of tethers your patient has, and you can also ask the nurse if there's any way to discontinue some of the tethers, such as saline locking the IV or discontinuing the tube feeding for the time of the transfer. I'm going to go over now and show you how to transfer a patient. Another important rule is to make sure the bed is in the low position and that it's locked so that it doesn't move while the patient gets out of bed. And another rule is to always have your dominant hand on the patient while transferring and then a non-dominant hand on the tether. Our patient has a saline lock on her IV, so she doesn't have that tether, so her only tethers are a Foley, catheter, and oxygen. So a rule for the Foley bag is when you're removing the Foley, you can attach it to the walker below the patient's waist so that there's no risk for infection, so that eliminates a tether. So now we're going to show you how to transfer a patient. You're going to pick up both hands and then leave the dominant hand on the patient. You're always going to assess the patient for fatigue and ask her how she's feeling. If she sounds fatigued or looks fatigued, you can always have a backup plan and have a nurse push a wheelchair behind her so she doesn't fall. And that is the rules on transferring a patient with tethers.